Okay, we are moving forward. So we are talking about cardiovascular agents. And some of the things that you should know is some of the most widely used medications available used to treat disease and conditions of cardiovascular are for cardiovascular agents. You have many different types of cardiovascular agents, which includes anti-anginals, antiarrhythmic, antihypertensive, vasopressors, anti-hyperlipidemic, thrombolytic, and anticoagulants. So you have arrhythmias. Normally, the electrical system of the heart causes it to contract or beat in a regular and organized rhythm that can be grasped by an electrocardiogram or EKG or ECG. And a definition that you should be familiar with is arrhythmia. Arrhythmia is a normal heart rhythm that can be inferred with the heart's ability to pump in an effective, organized manner. And different types of arrhythmias is tachycardia, which is heart beating too fast, bradycardia, heart beating too slow, premature ectopic beats, it means there's not a regular heartbeat, or flare of fibrillation, in which the heart is actually fibrillating very, very rapidly. There's no major heartbeat at all. So again, arrhythmia means a normal heartbeat. Another definition that you should be familiar with is called cardiac cycle. The contraction and relaxation of the heart that pumps blood to the cardiovascular system. And you should also be familiar with the term diastolic pressure. That is the minimum blood pressure when the heart relaxes and the second number in the blood pressure reading. Other definitions that you should be familiar with is electrocardiogram. This is a graph of the heart rhythm. Embolism or embolus. This is a clot that travels in the bloodstream to a point where it obstructs flows. Myocardium is the heart muscle. Systolic pressure is the maximum pressure when the heart contracts. This is the first number in the blood pressure reading. And thrombus is a blood clot. So when we talk about conduction, the heart is a pump that uses complex chemicals and electrical processes to function. This contraction and relaxation is referred to the cardiac cycle. The heart is part of the cardiovascular system. It's a muscular organ that provides blood circulation to the entire body. It has 4 different chambers. It receives deoxygenated blood on the right side, oxygenated blood on the left side from the lungs. And it has a very powerful muscle called the myocardium that is supplied by fresh oxygen rich blood by the coronary arteries, which is the best of the order, and circle back to the heart. And it's a very effective organ in which keeps us alive. Alright, so the class of cardiovascular agents is classified by its mechanism of action. For example, you have beta blockers. Beta blockers are drugs that reduce the oxygen demand of the heart muscle. An example of that is propranolol. You have calcium channel blockers. These are drugs that relax the heart by reducing heart conduction. An example of that is verapamil. You have diuretics. Diuretics decrease blood pressure by decreasing blood volume. An example of that is furosemide or brand name Lasix, a very popular drug. You have ACE inhibitors. The old drugs. That's an easier way of recognizing this particular drug. ACE inhibitors relax the blood vessels. They are often used to treat high blood pressure. Notice anything that has sartan in it is also considered a subgroup of ACE inhibitors. An example of that is captopril, brand name Capotine, enalapril, brand name Lisotec, and lisinopril, brand name Zestril. Okay, so anything pril will be an ACE inhibitor. Other cardiovascular agents are classified by condition. Okay. For example, the anti-anginals. Anti-anginals are used to treat cardiac-related chest pains. Another name of chest pain is angina, resulting from ischemic heart conditions. An example of that is nitroglycerin. Antiarrhythmics are used to treat irregular heart rhythms, and we talk about drugs such as digoxin. Okay. Digitalis should also fall under the digitalis was discovered during the 1700s, and one of the first drugs that we learned about in chapter 2. Okay. Antiarrhythmics can also include beta blockers and drugs that block sodium, potassium, and calcium channel. You have anti-hyperlipidemics. Anti-hyperlipidemics are used to lower high levels of cholesterol that can lead to blocked blood vessels. And a very good example of that is simvastatin. Okay. And then, of course, you have the antihypertensives. Antihypertensives are used to reduce sustained elevated blood pressure. An example of that is mifepristone, and we have what's called Altace, which is an example, which is a brand name of mifepristone. Other cardiovascular drugs that you should be familiar with is trombolytics and anticoagulants. Trombolytics dissolve blood clots, and anticoagulants prevents their formation. An example of that is alteplase. And then you have anticoagulants that we've been talking about. Remember when we talked about the heparin that's found as part of the mechanism of where blood, when you give an IV, and you do that to prevent clotting at the site of injection to the vein of the IV. Warfarin, whose brand name is Coumadin. These are two major drugs that are anticoagulants. Your vasopressor acts to increase blood pressure, and an example of that is dobutamine. Okay, so you should be familiar with these different types of drugs. Okay, let's talk about the dermatological drugs. When we talk about dermatology, we talk about the skin. Skin has different layers associated with it. The epidermis, which is the outermost layer. You have the dermis, which contains the vessel nerves, and then you have the subcutaneous layer. As we call that, the hypodermis, which contains adipose tissue underneath that. You have muscle. So the skin is the protective barrier. Why is this first line of defense? Some people consider it the largest organ of the body. When we talk about dermatological, this refers to a drug used to treat condition or disease related to the skin. The different type of drugs that are related to treatment of dermatological challenges can be many. Okay, and so the following examples that I'm going to mention to you are skin reactions that dermatology can address. It could be trauma, such as burn concentrations, fluid accumulation such as edema, coloration, and pigmentation such as that also rashes and freckles, hypomelanin, skin pigment, dry skin and scaling, such as dandruff, cancers like Betsy cell, squamous cell, or adenoma, and non-malignant growths such as psoriasis. Right. So it can also be used to treat other diseases such as eczema, cirrhosis, psoriasis, acne, fungal infection, viral infection like simplex, and then just general dermatitis, hives, and other allergic reactions caused by heat, cancer, insects, and also burn. Some example of such drugs are hydrocortisone, which is a steroid, and the brand name is Westport. You have antihistamines, that is diphenhydramine, anti-infectives such as silver sulfadiazine, and then antimetabolites such as fluorosil. Okay, so those are all very, very important. You have now, let's take a look at electrolytic agents. When we talk about electrolytic agents, maintaining a proper balance of the body fluids is essential for good health and function. Water is a primary element of the body, so that close to 70% of the body is water, accounting for a significant part of the body's weight. It is found in the cell. Consider intracellular fluid. Outside the cell, we put extracellular fluid. And then if it's in the plasma or tissue, it's the tissue fluid. So some of the definition that you should be familiar with when you talk about electrolytic agents are the following. Electrolytes are water-soluble substances that are contained in our body fluids as salts. They form electrical charged particles called ions, which attract water. They have both positive cations or negative ion charges, and are responsible for fluid moving into and out of our cell. Very good examples of common electrolytes include sodium, which is positive, potassium, which is positive, calcium, which is positive. If you look at it, it would be calcium 2 pluses. Chloride, which is negative, and bicarbonate, which consists of hydrogen, carbon, and 2 oxygen, which is negative. Okay, and when we talk about positive or negative, we talk about in relationship to the electrical charge. And these particular electrolytes are very important in terms of maintaining blood pressure, blood coagulation, muscle contraction, cardiac production, energy levels, and enzyme reduction. Okay. So we talked about the common electrolytes, sodium, potassium, chloride, and bicarbonate. So the maintenance of electrolytes is very, very important in terms of having a very healthy function. One of the electrolytes that is used a lot is called lactated renal solution. It's balanced in isotopic solution. Balanced means that the electrolyte concentration is similar to serum, and isotopic means the osmolality is similar to serum. Lactated renal solution contains sodium, potassium, calcium, and lactate. You should be familiar with that. And then a lot of times to IV, we have normal saline, which is an isotonic solution of sodium chloride. And isotonic is usually this big solution is 0.9% sodium, which is equivalent to most percentage sodium in the blood. Alright, so you have a potassium chloride, which is a potassium supplement, and then you have electrolyte replacement.